Hello and welcome to another episode of Podiatry Weekly. My name is Dr. Kazak. I'm a practicing podiatrist in Northern California. On this episode, I'd like to speak with you about a very common pathology, an ingrown toenail. Here I'll try to do my best to describe everything that you wanted to know about an ingrown toenail, but maybe were afraid to ask. Here we go. Um, what's the best way to treat an ingrown toenail? Well, among the foot and ankle problem I see on daily basis, an ingrown toenail probably gets a top 5 position. It takes the top 5. This is a very common thing that I see in all age groups and all sport groups. They occur because of changes to the nail plate itself. For example, thickening of the toenail, widening, excessive thinning, or splitting of the toenail can cause it. Injury or enlargement of the skin around the nail, called the nail folds, which can force the skin around the nail onto the toenail plate, cutting of the nail into the skin, or impaling the skin onto the toenail. And then this, of course, causes microcuts, which are then portals for bacteria to get in. Another reason, of course, is excessive foot sweating, which can lead to fragile skin around the toenail to form, and then it makes it easier for the sharp nail edge to cut into the skin. Sports or activities that involve frequent blunt trauma to the nail from the outside or the inside of the shoe can frequently result in an ingrown nail. Certain athletes, such as soccer players and ultramarathon runners, are more prone to nail injuries overall, and the ingrown nails in particular. In fact, I have had several ultramarathon runners that came into the office requesting that all of their toenails are removed because they're just tired of the bleeding that occurs around the toenail, and also tired of potentially having some of the toenail completely rip off as they're running, hundreds of miles. So they would rather not deal with it, not deal with infections, not deal with wounds forming because of the trauma, and they want the nails gone permanently. So what happens if the toenail grows in and you don't do anything about it? Well, an ingrown nail will lead to swelling, redness, drainage, pain, and ultimately infection. And that's the worst thing that can happen, of course, is the infection. So while treating the nails without a procedure is possible, it is a very time consuming and unpredictable in terms of consistency achieving a positive outcome, process, and prospect. Therefore, most foot surgeons tend to recommend surgical resection of the nail fold or ingrowing part of the nail with partial burning of the nail root to treat the ingrown toenail and also prevent the nail ingrowth from reoccurring. So what are some non-surgical ways that this can be treated? Well, non-surgical treatment of an ingrown nail includes soaking the foot in salt warm water, adding salt, Epsom salt, or even regular table salt to promote reduction of the swelling of the skin around the nails could be very helpful. And then petting the skin dry, and then taping the nail fold to pull the fold away from the nail. It could be very helpful. Some people recommend placing a small ball of cotton or another device underneath the edge of the nail to pull it away from the nail fold. And although these treatments may work to reduce the symptoms, they ultimately don't address the pathology or the nail growing in, the nail cutting into the skin or pressing into the skin. So they can relieve some of the symptoms, but I think most of the time the condition will reoccur. Um, so it's tough. It's tough to predict, but it's worth a try if you have the time and the energy and the dedication. Sometimes it works. So taping. Taping involves attaching a strip of tape to the nail fold over ingrowing nail in such a way as to pull the nail fold away. So if this is your, ingrowing nail, you'd put some like a paper tape, paper strip here, and then you would apply it on tension and therefore pull the nail fold away from the nail. Um, if you bathe, of course, the tape will likely come off. You can use a kinesio tape, like cutting a small strip of that, and that could help keep the skin away. And some of the kinesio tape that's higher quality actually stays on fairly nicely, even when you shower. You can try packing a small cotton ball underneath the toenail in growing corner, as I mentioned before. If this is done in cases of nail ingrowing for more than a day, significant pain may be associated with this procedure. However, this maneuver physically pulls the nail plate away from the skin fold, with resulting improvement in pain. Although most of my patients, I think, would find it very, very painful, especially if the nail fold is not just ingrown but also inflamed because of the infection. And of course, this procedure must be done daily and for a fairly long time to achieve any kind of improvement or resolution of painful symptoms. Some people recommend using dental floss instead of cotton because it's thinner, a little bit easier to manipulate and maneuver. And then it could be used just like cotton ball. You can roll it and pack it in there, or you can kind of stick it underneath the toenail and maybe pull the nail up a little bit. Um, but again, this is something that you have to be doing daily, and when the nail is really inflamed, it certainly is very painful. Some resources, some people uh, started to recommend nail braces. These are various devices that go on top of the nail or get placed underneath the edge of the nail to straighten out the nail plate. These devices are more helpful for pincer or dome-shaped nails, so nail that kind of looks like this, as opposed to a straight nail growing in, because it's, if it's gonna straighten the nail, if the nail is already straight but cuts into the skin, it's just not gonna do anything. And of course, if the skin folds around the nail are enlarged, that's also not going to be very helpful. So, do they help some people? Yes. Do they help most people? Probably not. One of the main reasons for ingrown corners of the nail is inappropriate nail cutting technique. So when the nails are cut too short or torn off, the distal skin at the edge of the nail rolls and becomes thick. In fact, it tends to be taller than the nail plate itself, and this prevents the nail from growing forward as a whole or in the corner. So the skin here, if you cut the nail too short, it'll just kind of roll up, and then it will get in the way of the nail growing forward. So you'll get a short stubby nail, or the nail in the corners may grow in as well. Um, Sometimes a nail spicule will remain in the corner of the nail, and so you'd cut the corner but not all the way, and this is particularly common when there's pain and inflammation, because cutting deep into the corner is very painful, and so you can't, it's too painful to go all the way in and remove all of the nail, and then that little piece that you left in there turns into a painful spear that then pierces into the skin and causes more infection. So another reason for ingrown toenail is um, a bone spur that forms under the nail plate, and that you can see. You got to do an x-ray. But if you do develop a bone spur growing up underneath the toenail plate, it will deform the nail from the inside out. Sometimes those bone spurs occur because of chronic trauma or chronically tight shoes. But once it's there, it's there. You can't remove it outside of surgery. An X-ray is required to really visualize it, and but once you visualize it and you diagnose a bone spur in the area, then you know how to treat it, or at least you know that the nail will not change its shape unless that bone spur is also resected. So what will happen if you leave your ingrown toenail untreated? Well, It depends on many things, but mostly has to do with other medical conditions affecting your body. One of the most common outcomes is a deep-seated infection that results from the nail plate cutting into the skin, and bacteria then or fungus that lives on the surface of the skin invading, right? And then you need antibiotics, you need antifungal agents to treat this condition. Sometimes you may need surgery if you develop an abscess, or at least a small procedure. If you develop cellulitis or spreading of the infection away from the original injury site, then you may need to go to the hospital and get intravenous antibiotics to improve the condition. Sometimes surgery to remove the nail plate aspect growing in, or even the whole nail. If you don't, some of this bacteria may then jump into your bloodstream, causing bacteremia, and if it spreads throughout the whole body, then you may develop sepsis, which is a body response by immune system to infection, and if that goes untreated, then death may follow. So something as simple as an ingrown toenail left untreated and causing serious infection may ultimately result in death, unfortunately. So it's best to get it treated as soon as you see that the home remedies don't help. If you've done your soaks and other things that I mentioned for maybe a day or 2 3 days at most, and you're not improving, it's unlikely to improve. So you should definitely consult with your medical provider to get it treated. If you get infection diagnosed early, it could be treated either with a small procedure like removal of the part of the toenail, and also prescription of an antibiotic pill. So, of course, untreated ingrown toenails will continue to create pain and will lead to inability to wear tight-fitting shoes, and even sock wearing may become painful. Patients who are immunocompromised, like diabetics and those on dialysis, or those undergoing cancer treatment, infection can progress much faster. And so if you're in this age group, or even if you're in this health group, I would probably recommend going in as soon as you notice that the nail is ingrown, not waiting several days, because when the immune system is not there to fight the infection, the infection progresses very quickly, and the surgeons may not be able to save your toe, or maybe not even your leg, if you go too late. Poor sensation can develop for various reasons, some of which include uncontrolled diabetes, vitamin B12 deficiency, folate deficiency, exposure to Agent Orange, injury to nerves in the lower back, which could be traumatic or arthritic. Viral infection can cause these symptoms, alcohol abuse, nerve injury in the legs, tumors around the nerves, poor circulation, immune system disorders, fibromyalgia, strokes, even multiple sclerosis. Um, these are just a few things that can cause a neuropathy or poor sensation in the feet. And so, of course, if you have poor sensation, you won't feel the injury, and even if you see the injury, you may not appreciate the extent of that injury, the extent of that infection, and you'll just end up with a severe infection, and may in fact lose your toe or your foot or your limb over this. So acting quickly is of paramount importance. So what about treating ingrown toenails in babies and toddlers? Well, in this age group, ingrowing nails tend to resolve on their own after a month or two. Most babies and toddlers have very good immune system, and their body is changing, and so most toenails really kind of go away. Most ingrown toenails um, improve on their own, but if they don't, again, similar procedures are available. And treatment again may include soaking the foot in warm soapy water. Application of an antibiotic ointment may be appropriate here, but if that doesn't help, then surgical resection is available. So what about the surgery approach? What does that mean? Well, either a complete or a partial toenail removal can be undertaken, and I strongly recommend against removing of the whole toenail, as this is a very traumatic process and may result in permanently deformed toenail once it regrows. That's always a possibility. So partial toenail removal from the side that is ingrowing is almost always preferred and appropriate and really enough. The only reason to remove the whole nail if you already have a narrow nail plate from maybe previous nail procedures, or if the nail is not only ingrowing but also thick and infected with fungus, or maybe both borders of the toenail, like more than 50% of it is involved in the ingrowth process. Removal of the whole toenail plate, of course, may result in an improved appearance of the toenail if your toenail is like extremely thick because of the fungus or dystrophy of the nail from previous trauma. So you may end up with a toenail that looks a lot better. Removal of the nail is, of course, painful, so local anesthetic is usually used. It is important to share with your doctor if you're allergic to local anesthetics, and specifically like to what anesthetics, as your doctors, of course, has various anesthetics available that would not cause an allergy or other complications. Once your toe is numb, the numbness will persist for 4 to 6 hours depending on the anesthetic agent used. There are 4 nerves located in each corner of the toe, so each one of those nerves must be anesthetized to achieve for total pain-free toenail removal. So there's a nerve in every corner of the toe, each corners, and so all those corners must be addressed. Unless only one part of the toenail is ingrown, then you have to only address the 2 nerves on that side of the toe. So when the painful toenail portion is removed, then you'll have 2 options. You may choose to let the nail grow out and observe it carefully for any evidence of ingrowing, or you can take a more invasive approach and have a special chemical applied to that corner of the toenail, and then that chemical will kill the root of the nail in that corner, and which should prevent the condition from reoccurring. The chemical will cause a chemical injury or a chemical burn, and so you will have to do some wound care to get to healing. After the chemical is applied, drainage is expected, but drainage should be clear and should not persist longer than a week or 2 if you are a healthy person. It may last longer, and healing may take longer if you are immunocompromised, again, like in conditions like diabetes, or you're on chronic prednisone therapy, or other immunocompromising conditions may result in prolonged healing, or if you have poor circulation, for example. But again, most pain is usually, if you're a healthy person, most pain is usually gone by 2nd or 3rd day. It may feel like a small bruise around the toe. You may have to wear loose-fitting shoes, loose-fitting socks for a little bit. And then ultimately within a couple of weeks, everything heals up and you're back to normal. So I hope this information was helpful to you. If so, please share this with your friends, with your neighbors, with your family, with people you care about. I hope it empowers you to make educated decisions about the treatment of your ingrown toenails, gives you some resources to discuss with your foot specialist when you go in for a procedure like that, or accompany somebody that goes in for a procedure like that. If you find this information helpful, please subscribe to this channel so that you won't miss out on any future broadcasts or future informational videos that I will be putting out for your entertainment and education. Thank you very much, and take care.